Hello everyone and welcome to my YouTube channel. This is Dr. Naz and today I'll be discussing about idiopathic pulmonary fibrosis. So it is the most common type of idiopathic interstitial pneumonia, and idiopathic interstitial pneumonia is one of the diffuse parenchymal lung disease or a restrictive lung disease. So basically idiopathic pulmonary fibrosis is a restrictive lung disease. What is the definition of this disease? It is a progressive fibrosing interstitial pneumonia of unknown cause. Etiology is unknown, so that's why it's called idiopathic. Associated with radiological and histological pattern called usual interstitial pneumonia. So you will get the histological pattern and radiological pattern of idiopathic interstitial pneumonia, and there will be progressive fibrosing of the lung parenchyma. So the disease usually presents in the age of 50 to 70 years and it is uncommon before 50 years of age. There will be progressive dyspnea and non-productive cough. Hypoxemia will be there because of decreased gaseous exchange due to fibrosis, and there will be finger clubbing. Bibasal fine and inspiratory crepitations, also known as crackles, can be heard, and they will be heard like a velcro type crackles. If you have seen a velcro getting detached from the other velcro, the sound it produces, it will be the same. Central cyanosis and right heart failure, which is also known as cor pulmonale, can occur in advanced cases. There can be the presence of fever, weight loss, inspiratory squeaks, mild inspiratory high pitched sounds. These all can be the features. So the investigations include pulmonary function test, which will show a restrictive pattern. It means there will be decreased lung capacity and residual volume. However, there will be increased FEV1 to FVC ratio, because FEV1 is either normal or decreased, but there is marked decrease in forced vital capacity. Therefore, the ratio of FEV1 to FVC will be increased. Peak expiratory flow is normal, and diffusion capacity of carbon monoxide will be decreased, so there will be decreased oxygen gaseous exchange across the alveoli. So chest x-ray will show initially ground glass appearance. And what is ground glass appearance? There is mild haziness over the chest x-ray, but it does not obscure blood vessels and bronchi. It is followed by irregular reticulonodular shadowing, mainly in the lower lobes, and eventually honeycomb lung. What is honeycomb lung? It is multiple cystic dilations, cystic spaces, and there will be thickened bronchial walls. High resolution CT scan is a critical investigation in all kind of diffuse parenchymal lung diseases, and because idiopathic pulmonary fibrosis is one of the examples of it, so we will perform HRCT over here as well. And you can clearly see it's a beautiful honeycomb appearance, and there are cystic spaces with thickened bronchial walls, and these all are giving a very beautiful picture of honeycomb. And it's similar to X-ray, but the finding is more sensitive over here. So lung biopsy can also be done either transbronchial or video assisted, and it can send for histopathology, and there you can see the same honeycomb fibroplastic foci and dense fibrosis. These can be. So how do we treat idiopathic pulmonary fibrosis? We will give oxygen for dyspnea, opiates for severe dyspnea, thalidomide for cough, steroids, example prednisolone, should be given if there is severe disease. Immunosuppressant can be given, as a thioprin is an example. Tyrosine kinase inhibitor, antifibrotic agents can also be used, and definitive treatment is lung transplant. So this is the end of the video. If you learned something from it, please do like it and share it with your friends, and subscribe to my YouTube channel. Thank you so much for watching.